Hi, everyone. Good evening. Hello. Thanks for joining us. This is the M Beauty Clinic Winter Zoom event. And I'm here, Dr. Tess Mauricio, for those who don't know, with my sister, Angela.
Hi, Nurse Angela, and I'm the lead RN for M Beauty Clinics by Dr. Tess. And just in case you guys don't know us, we'll introduce ourselves. Dr. Tess, one of the greatest of all time dermatologists. Really, you are like on social media, I do see it. You are considered one of the goats of cosmetic dermatology. Yeah,
Did you ask ChatGPT?
I'm sure it'll agree. I'm sure it would. Okay, quick bio on you.
Oh, you're gonna give it?
No, you give it.
Oh, I give it. I give it. Oh my gosh. Okay, so we've been in practice M Beauty Clinic. We celebrated 20 years last year, so this is our
Actually, technically,
first year.
2 calendar years ago,
Yeah.
2024. So we are in our 22nd
Yes,
year of
22
practice.
years of
in 2023.
practicing. And we love serving our patients, thousands of patients that have trusted us through the years, through the many years. I am a board certified dermatologist, and this is M Beauty Clinic is a dermatology practice. And we're going to really talk about that today because there's a lot of confusion out there right now.
Yeah.
But this is a dermatology office. We do have 3 locations. One in Miramar, San Diego. We have Chula Vista, and then I see patients in Beverly Hills as well. And our expertise is really in, naturally turning back the hands of time. And obviously, as a dermatologist, I care a lot about the skin, hair, and we also do body treatments as well. But really, my passion is regenerative therapies and making sure that your skin stays healthy, resilient, and glowing through the years. And Angela here has been with me through the whole journey, 22 years as well. And I'm just so happy that I get to work with my siblings.
Yes. So I'm Angela, and again, I am the lead RN for the practices, and I have been an aesthetic nurse for 18 years. So
But you look 18.
We may look young, and people might think that we're new to the game, but no, we are not. Our years of practice, it's legal now.
Yes.
It's legal.
Yes. And also, but what is amazing and why we continue to be so passionate about what we do is it's really different when you see the effects of these treatments on your own skin. And I've always had almost a theory when I first started that if you are consistent with your treatments, you really can maintain your skin. You actually can be improving your skin as years go by, and you can reverse the aging of time and sun damage and all of that. And now this year I will be, oh God, it's a milestone birthday.
Woo!
It's pretty big. 55 this year.
Oh my
and when I was in medical school many years ago, more than 22 years ago, I never thought that I could at this age have this kind of skin and hair and still look
Absolutely.
really, youthful. And it's possible for all of us. And that's what we do at M Beauty Clinic is really guide you, be your partners in doing that because there's so much out there. It can be confusing, and that is our goal is to be your partner, skincare partner for the rest of your life. So.
Very cute. And then since we've been in practice for such a long time now, we have been able to take our patients along with the same journey as Dr. Tess, where we've met patients in their 30s, and there's like one in particular I'm thinking of, and now I know this March, I believe she is turning 50. And then there are some patients where we met them
50s.
Before they were even married, and then now we're treating their teenagers, right? So skincare is a journey that is lifelong, and it can start when you are young and really your whole life, right? Like you can maintain your skin. And I think when we had first started the practice, I think back then 50s, it was like, oh, that's old.
Yes.
But I really don't think that's the case anymore, right? Like with just the ways that you can take care of yourself and also the knowledge that the general public has now about being able to be healthy on the inside and out. And then even just like mental wellness. Like
Absolutely.
I think looking your best, you will truly mentally even feel better. It puts a pep in your step, and you just really do feel like you're putting your best foot forward. So
Right. And
This
it's
is
been
important.
and it's been studied. So it's not just something that we see in practice. It's not just something that, personally we
Right.
practice ourselves.
It's proven.
It's proven, the connection with you when you look in the mirror and people responding to you, people giving you compliments. It really does give you an inside boost. And also we do take care of patients as well who are going through tough times. Like if they maybe have had illnesses.
Yes.
Or have been caretakers of relatives and stressed or gone through divorce, that kind of thing. Where stress really can affect your skin, it can affect your hair, and we can really help reverse that. We can help restore you. And now more than ever in 2026, we truly have incredible technologies to really get you there. Whether you just want to start off with skincare, we're going to talk about skincare today. We're going to talk about basics. We're going to talk about affordable ways to really maintain your skin. And then to, incredible technologies to really reverse the aging process.
Yeah.
Like our
And I think too, like you did touch on this earlier where, our specialty is really regenerative and also just very natural looking results.
Yes.
And I'm so glad that now that's in. Okay, because like we have been preaching this for 2 decades.
Yes, 20 years.
And I finally feel like vindicated, right? Where it's like you've always been conservative and you've always preached about that.
Right.
That it's important to still keep your features and to look like you. But if you just do little things along the way, you can still really just maintain how you look and just kind of preserve yourself.
Exactly.
So yeah.
All right. So thank you again for those who are joining us. It's not too late to invite your friends and family to join us. Just share the Zoom link. And 2 of you will be big winners tonight. Woo-hoo! If you stay till the end, there will be a raffle for a free hydrofacial or a glow peel. That is really amazing.
love.
So not only are you going to learn the latest technologies, but you also have a great chance of winning. Okay, so let's start. We're gonna present, and thank you. Shout out to Lisa who is helping us. It's been so busy in the clinic, and so we got the presentations going. And any questions that you have, we want this to be interactive as much as possible. Type in your questions. Lisa will see the questions, and then we will try our best to answer them for you as soon as possible. Okay, so we're talking about winter skin essentials here. And so what happens during winter time is that we know as dermatologists that winter is the toughest season for our skin. And there are many, many reasons. Obviously, the weather changes. We're using more, heat. The air is drier when there's heat. We're also using hot water. And so that can dry the skin. And so we need to just make different skincare changes that could be very simple, but it really can make a difference. And so do you want to just turn on the presentation?
Yes.
Yep. Right. Okay. Go ahead and start.
Sure. So Dr. Tess had just touched on this as far as why winter is hard on your skin. And there are many factors to this. And even just within these last 2 weeks alone, there were patients that I saw. And as I was treating them, I told them, like, hey, have you noticed that your skin is very dry? And I've had to suggest different types of rescue products and rescue regimens for them, just so that their skin can feel relieved. And then also you yourself, like you can tell when your skin is dry. It has this kind of thirsty feeling. It can feel irritated. It can feel tight. And then for those, itchy. And for those who have eczema and rosacea, it's a particularly hard time for your skin and it can flare.
Absolutely. And being a dermatology office is really a bonus for all of you, because most places do not have an in-house dermatologist. And for those who don't know, dermatologists, we are the skin specialists. So our training really involves many years focusing on the skin. So we go through medical school.
How long is medical school?
Medical school is at least 4 years. And then after 4 years, we get our MDs, and then we go through what's called a residency program. So we do 1 year of internal medicine, and then we do an extra 3 years of just focusing on the skin. And so being and plugging yourself in a dermatology office versus a medical spa, which we'll talk about, really is a benefit to you, because if you are having problems with your skin, whether that's your, what Angela discussed, they will let me know. And then I personally am the one to give you your, the treatment plan, the changes and alterations in your skincare, rescue your skin so you don't suffer. And also, if you need something that's prescription, we can handle that for you as well. Next. So common winter skin mistakes, I think over exfoliating is number one. And this is something that if you have very sensitive skin, we actually tell patients maybe only once or twice a week. And this is overstripping the skin of moisture, really can make your skin not happy. And especially also if you are having hormonal changes, perimenopause, menopausal skin, in the winter time, it already is dry to begin with. You don't want to overstrip. You don't want to overscrub. Can do the second one.
Sure. So skipping sunscreen because it's cloudy, that is a big, big no-no. The UV rays are still peeking through, even if it is cloudy. So please, sunscreen needs to be a daily ritual that you do every morning before you step out of the house.
Yes, and no matter your skin color as well, sometimes it is a myth that if you have darker skin, you don't need sunscreen, and you absolutely still
true.
Actually, if you have skin of color, you are more prone to discoloration, post-inflammatory hyperpigmentation after treatment, and also melasma. And so if you don't use your sun protection sunscreen every day, you are really putting yourself at risk. The next one, using summer cleanser. So we need to adjust our skincare regimen. We'll go over some products that we love that really can hydrate the skin instantly. And also switch your cleansers to a cream cleanser, and then also moisturizer instead of more of a serum. Maybe add on a richer, creamier
that makes sense. Right. That makes perfect sense. And then also taking long hot showers. Oh, I love hot
cold.
Showers. Yeah,
I do that, but you need to kind of know that you're gonna do that.
And then you need to replenish, your moisture if you are doing
or maybe you do it quick, but don't really
not every time. Don't do those long hot showers every single time.
That's the no-no. If you have eczema, if you have really sensitive skin, you will trigger your atopic dermatitis or eczema if you do that. And then also hot baths. You love to soak, but you also can dry the skin that way. And then not changing your skincare, and we'll talk about that next. Yes, so what's the difference? Yeah, so this could be a whole entire lecture, and I've given this lecture before as well. But what is the difference between dermatologist recommended skincare or medical grade skincare versus all of the crazy TikTok trends that are out there? It's kind of scary that a lot of people, especially younger people who watch TikTok and social media, get their skincare recommendations by influencers who really don't know anything about skin. They may be famous, they may be cute, but
they may
be born with great skin, but it doesn't mean that they have the training expertise to really make recommendations. Also, you have to be aware that those influencers are also paid to make certain recommendations. So you have to take their recommendations with a grain of salt. And so what we do here at M Beauty Clinic that is totally different is that if you are not our patient yet, we offer free consultations with our cosmetic consultant, or an actual live in-person or Zoom consultation with me, and I will put together a plan for your specific needs. And sometimes we really have to mix and match, and sometimes we have to repair the skin first before we do treatments. We have to prep the skin first before we do treatment. And so we can get down to the nitty gritty, and then you can trust that the products we're recommending actually work. There's scientific basis to them working. You're not wasting your money, you're not irritating your skin, and you're not causing damage. And the recommendation comes from a dermatologist.
Yes, so every single patient that is seen at M Beauty Clinic, the recommendations do come from Dr. Tess.
Yes.
Whether it's because you were seen in person or if you meet with a consultant, Dr. Tess will review your photos, and given your what you had spoken about with the cosmetic consultant, Dr. Tess will give you feedback and a quote based on that. And then the other thing that I'd like to point out is sometimes, like when you get advice, maybe from non-reputable sources, you know, might seem kind of cool because you can see reaction happening right away on the skin. But when you get your advice from a dermatologist, and when we are giving you advice regarding like skincare, it's going to be low and slow a lot of the time, right? We want to be gentle with the skin, and we want to make sure that we are not causing harm. So a lot of those harsher skincare products, we actually would really prefer our patients to avoid them.
Right. And it's really about being consistent as well.
Yes.
And depending on your skin type, even though the instructions say use twice a day, use every evening, based on my assessment of you and your skin and your previous reactions to products, I may change that. I may tell you only use this product every other day, only use this product once or twice a week. And so the regimen really is catered and tailored for you. And it comes from a dermatologist. That's all I'm going to say. So our patients are very, very lucky that way as well.
They really
it's
are.
very hard to get to a dermatologist. Try to do that. And it may take you 3 to 4 months to see an actual dermatologist. If you go see a dermatology office, you're probably going to see a dermatology PA, physician assistant, or nurse practitioner. At M Beauty Clinic, you really get seen by a dermatologist if you want to, and all of your recommendations are made by me. So the products that you see there are some of our most personal favorite products that I personally use. The two that we're going to really focus on today are the Aqua Infusion Mask, which we're talking about winter rescue. This I put on my skin every day.
I do it 2 times a day.
You do? Okay,
yes.
I do it every day because I'm still a little acne prone here on my chin. So, but this is wonderful if you feel like your skin needs a little, calming down, moisture. Aqua Infusion Mask. It's really amazing. It's the microderm. So this one, it comes out like a gel, and then you apply it, and then it just kind of gets absorbed and disappears. So usually what I do, I wake up, I put this on my skin, and then I'm doing all of my chores and all of that. And then you step in the shower or wash your face, and your skin is instantly rescued and moisturized. And so this I love, love, love. I put it on my face, I put it on my neck, I put it on my hands. I also definitely travel with the Aqua Infusion Mask. I'll be going to Tampa. I'm speaking at the American Academy of Cosmetic Surgery on Friday, and it's super cold in Florida. And so I'm going to bring my Aqua Infusion Mask because when it's very cold, your skin will dry up, and you'll need that instant rescue. So I absolutely love this product. The other one that is there is the microderm polish.
Yes.
So
I actually leave this in my shower.
Me too.
Yeah,
I think you heard that from me.
Oh,
she got that.
no,
from
great
me.
minds think alike. I've also been in the industry.
That's the best place to actually,
because you're not supposed to use it every day.
yeah,
Right? So I like to
the scrub. Yes.
Yeah, it's and I like to it's like a micro
Dermabrasion.
polish. Yeah, so the beads that are in it are so fine. They are circular, which I don't know if people really notice these things, but when you buy cheaper types of scrubs, like maybe over the counter, they're not circular.
They're larger granules, they're sharp edges,
and they can scratch the skin.
Yes, and if you have sensitive skin, which we do, I had eczema, when I was younger. I have very sensitive skin. This is very, very fine granules.
And it feels good.
Right.
It
and
feels
it's polished.
very nice on the skin.
It's an instant glow. And then you remove the dead skin, and it allows your serums, which we're going to talk about, to really, really absorb in the skin. So here's the Aqua Infusion Mask. If you look at my hands here, and yes, we absolutely treat hands because the other telltale signs of aging, your hands and your neck. So I would use the Aqua Infusion Mask. Actually, I'd use the Microderm polish on my face, my neck, my hands. And then
this is actually very fine. It almost looks, I think probably to the viewers, you probably won't even be able to tell the difference.
I'm gonna come close. Maybe we'll bring the camera closer. Or not, it's okay.
Yeah, so
just imagine, but there, so you can use
so
this
fine.
and then apply your cleanser in the shower, wash off, and then when you get out, you want to absolutely apply your serums. Serums always go first. And
thinnest to thickest.
Right, exactly. And then where is our the other one is our Prep and Enhance kit. The Prep and Enhance kit is amazing. It's complete. And it has, I wish we had one. We'll get one and then we'll talk about it here because it's nice to show the Prep and Enhance kit. But that it has everything that you need as far as antioxidants, as far as retinol, vitamin C. It has your sunscreen. And so in one kit, you basically have most of.
Can you briefly just say, like, quickly, benefit of vitamin C?
Right. So vitamin C is an antioxidant.
And then explain the antioxidant. I think it's a buzzword, but maybe not everybody is familiar with why that's important for the skin.
So one of the main reasons that the skin ages and causes discoloration is oxidation. So like think of rusting. That process is oxidation. So the oxygen is awesome. We breathe it, but it also can cause aging and degradation and cellular damage. So antioxidant means that you are blocking that oxidation process. One of the best antioxidants there is that's been proven time and time again is vitamin C. The thing about vitamin C though is that it's not very stable. And so the delivery system for vitamin C has to be, this is kind of the game changer part of it. And Illumia MD has an incredible delivery system for their vitamin C in that they don't combine the serum and the vitamin C granules until you're ready to use them. It's in a airtight. It's in a dark glass bottle so that sunlight doesn't oxidize it, doesn't cause degradation of the product, and also it's not irritating. It is combined with vitamin E plus also a peptide. So you're not just getting the Illumia MD vitamin C, you're not just getting vitamin C that's high potency in an amazing delivery system, but you also are getting vitamin E, plus you're getting a peptide. And peptides are a huge buzzword right now, both systemically, but topically. We've been using peptides here at M Beauty Clinic for many years, and the world's just catching on.
Yes.
So that's vitamin C. Another really amazing antioxidant that we use a lot here at M Beauty Clinic is glutathione. Glutathione is a master antioxidant, so you can apply it on the skin. Some of the Illumia MD products, like the Ultimate Boost Serum, the Illumini for your under eye area, and the Sheer Hydration Sunscreen, which I use, also has the antioxidant glutathione. And we also administer that IV.
IV, yes.
Yeah, you can talk about that.
Yeah. I actually really, really love the IV glutathione, and we also mix ours with vitamin C.
It's really
amazing. It's so great for just your immunity. It's great for skin health, your energy. And then I do, as well as my patients, I do notice that there is a actual brightness to the skin that is able to be photographed. So it's big. When you're looking at yourself, let's say in the camera or you're taking pictures, it really does look like you are filtered. But I typically will recommend that you get the treatment done in a series of 10 initially. So that's 10 treatments, 1 IV glutathione and vitamin C every single week. And it is a quick procedure. It is not in an IV bag. We are giving you pure vitamin C and glutathione via IV push. And it is a high dose, but it is safe. And then when you are done with the 10 weekly visits, Then you can do maintenance of, ideally would be once a month, but there really are a lot of clinical benefits besides just having brighter, more beautiful skin.
Yes, and Google that, because also for overall anti-aging, systemic anti-aging, glutathione is really incredible. And like what Ange said, immune boosting, gives you energy, and really decreases the cellular aging of your entire body, including your skin. And if you have discoloration issues like melasma, we really recommend IV glutathione and vitamin C, because then you're getting the antioxidant effects from within. You're like being protected from the inside, and then you're using the antioxidant products on the outside. So you're hitting it both ways. Next slide. Any questions again, please just,
next slide.
See it because they turned off the Zoom bar.
Oh, yeah.
Later.
Next slide.
Yeah.
Next slide.
Next slide.
Oh, yeah. Sorry.
Okay. All right. So we kind of touched upon this earlier, in that M Beauty Clinic is not a medical spa. We are a dermatologist clinic. Yes, we do aesthetic treatments, but we have a dermatologist, me, basically doing, your recommendations, looking at your problems, and then creating a customized program for you. And if there's any issues, you have a dermatologist.
I will actually say, so speaking from a nurse's perspective, I feel so safe practicing in this environment. So I don't know if many people know this, but when you do see what we call med spas, it may have a physician's name that is actually like on the business license. So yeah, like what Tess said, a medical director, but this could be any kind of physician, not a
Most
dermatologist.
likely not.
Because if not, it would be a dermatology office, right? So if a dermatologist owned the practice, it would be a dermatology office.
Yes.
So again, like the people who are doing your procedure, even if they are medical professionals, it may not mean that they are experts in their field. So I feel very lucky and I feel very safe practicing here, because if I have any questions about whether or not a growth is, let's say, a mole versus a skin tag, right? It's like
skin cancer.
Right. So it's great that I have someone who I can talk to, or God forbid, adverse reactions. That happens. It's always a risk whenever you do anything. I do have a doctor on board,
allergy or something. Yes.
So it is to your benefit to go to an aesthetic practice that is owned by a dermatologist, and that the dermatologist is present and actively practicing in the office.
Yes. And, it scares me sometimes, because as a dermatologist, I definitely know, and I definitely have diagnosed skin cancers. I think the most famous one is on Khloe Kardashian.
Yes.
Where, it's been looked at by other people, the growth on her cheek. And she shared this in, their reality show. And, when me as a dermatologist took a look at it, I said it's suspicious. We biopsied it, and she ended up having to have a huge surgery, where maybe someone who doesn't have that same expertise would just burn it off. Also, do not get your moles burned off. Angela always checks first. And so any kind of pigmentation on the skin, there are flat, very innocent looking things, growths, pigmentation on the skin that could be a skin cancer. And only a dermatologist who's been trained 3 years would be able to know if it is suspicious enough to do a biopsy. And absolutely, we have unfortunately diagnosed some. And it scares me to think that if it's been lasered off, it's been burnt off,
frozen off,
the pigmentation or the growth on the surface may be gone, but the cancer can still be spreading underneath your skin. So be careful. Next. All right. So let's talk about and watch our best winter treatments. So we'll start with the hydrofacial. Let's do it, Lise. Hydrofacial, I think every single one of you need to have a hydrofacial treatment. This is the biggest bang for your buck treatment, and it is multiple treatments done in one visit. So this is really the most economically wise skincare decision and treatment that you will have. So Lisa? Oh, can you advance, please? Okay. Hydrofacial. Okay, hydrofacial. So yeah, so hydrofacial treatments, really, we love it. We're one of the first actually dermatologist office in the country to ever bring on hydrofacial. It's clinically validated. We
had done a study.
Mhm.
Yeah, we did a study on hydrofacial and its efficacy on acne, and it was published.
Yes.
And it really clinically works. And we believe it, we've seen it. And again, now it is actually proven and published in a journal. But it makes sense. It is the ultimate cleanse for the skin, and it's just so smart. So it's so much smarter than just a regular,
Like if you're just massaging the skin. Yeah. Actually, they've done a study and they compared if you just had a manual facial, because a lot of you may be getting the manual facials. Hydrofacial, we'll show in the video, works through vortex fusion technology in polishing, in applying serums. And what they found is that compared to manual facials, you actually get better penetration and absorption of whatever products you're putting on the surface.
Yeah.
Plus, you also get collagen formation from the vortex fusion. So don't waste your money when someone is just massaging.
And there's like different boosters too that it actually pushes into the skin. It's just such a smart delivery
You're
system.
just gonna have a manual facial, just buy quality products and apply it yourself.
Yeah.
Okay. And then Keravive, or what they're calling now Hydra Scalp, the same concept can be done on the scalp. So let's just go in the videos.
Videos.
840. Oh, yeah. So here you go. So there are different steps to the hydrofacial.
And then that's Andrea. She's one of our estheticians. You guys have to come see her. We love her.
She's amazing. And this is me because I practice what I preach. So lymphatic drainage. So that's the first step in the hydrofacial, their signature hydrofacial. And lymphatic drainage is so important. It increases your blood flow. It increases oxygenation. It moves toxins. And so that alone, you can pay a lot of money just on lymphatic drainage.
Oh yeah, for sure.
But that is part of the hydrofacial treatment. And then cleansing. There is nothing that cleanses your skin like a hydrofacial. So you can see that there's vacuum. You can hear it if we turn on the volume. And this is working through vortex fusion. Play that again.
I kind of get happy just even like imagining myself like getting a
vacuuming all of your pores, deep cleaning.
If you have OCD, it's just glorious getting a hydrofacial.
So clean all the way down. There's no way. If you're getting a manual facial, there's no way your skin will ever get as clean as a hydrofacial. Do not waste your money. And then next.
Sorry, you'll hear it on this next one.
Okay, yes. Next, this one.
What's cool too is with the hydrofacial, depending on the step that the esthetician is doing, the hand piece has a different tip. So the tip is actually built a little different. Maybe the motions look different. So for example, like there's a hand piece that is specific for extractions. That hand piece is great for sucking out of the skin. And then there are other tips that are good for infusing products into the skin. It's very smart.
It's very, very smart. It's very well done, and lots of studies to prove that it really works. And it is one of the wow factors. Like you get a treatment and every single patient you're like, wow, I love it. Because it's also very relaxing, because I think people get a facial because they want to relax.
Oh, this is super relaxing.
This is super relaxing. It's not painful. It's not like old manual extraction that people are pressing on your skin. If you're still doing that, do not, as barbaric. You gotta do the hydrofacial. Okay, so this is, all right, so now this is, they're applying the boosters on the skin. There are very, very customized boosters that will be applied on your skin when you get a hydrofacial. So this is really amazing. I got the latest for overall anti-aging and hydration for, perimenopausal, menopausal skin. And that is the hydrophilic pep 9 booster. And I am this is kind of like my baby because I helped launch this.
Yes, that was really cool, actually. Like, she literally did a hydrofacial tour in New York. It was like a press conference. Was it a press junket?
No, it was a media tour. Yes.
Media tour.
Mhm.
And then they just kind of prop her up somewhere, and then bam, it's like interview after interview after interview, just like how movie stars, when they have a movie
Yeah,
release,
it is kind of
like
that.
I didn't even know where she was. Okay, I did not even know that she was gone. I can't ever keep track of her schedule. And then she's in New York, and I see her doing all these things. I'm like, what are you doing? And I was just like, oh, okay, celebrity.
It was amazing.
Yeah.
Thank you, Hydrofacial. And so we have a very, very great relationship with Hydrofacial. And I think that's also something to talk about is the relationships that we have with these incredible technology companies. And so our patients really get pampered.
Yes, and then they get the best of the best, because you will always get this, like whatever products or little boosters and add-ons. Like, we get it first.
The latest.
Because she's launching it.
Yes, exactly. So do our staff.
I know.
That's our staff.
Yeah,
stays
lucky
with us
them.
forever.
Lucky them.
So then that's the booster. So if you are getting a brightening booster, it'll be more antioxidants, more brightening
do you do
ingredients.
Peel? Do you get it?
I don't. I think I did get a little bit of the peel, but on the lower concentration.
So
I did get the peel.
3 different levels of the glycolic acid peel, and I think it's also salicylic acid too. It's a glycol. So depending on the type of skin that you have and what your needs are, we can customize it. So this is still going to be a very relaxing peel. And it won't be irritating. Right. So I do want you to know that you do get actual benefits, because sometimes people are like, oh, I want a peel. And it's like, don't worry, there is a peel included in the Hydrofacial.
And how many is that? Right? So you get the lymphatic drainage, you get the deep cleansing, you get the polishing. So this replaces microdermabrasion. People love microdermabrasion, but this one is not irritating because you're not using like sandpaper or like crystals. You're not irritating. It is through vortex fusion and the very specialized tip that Angela was talking about. And then you get a peel, and then you get hydration. You can be infused
and there's different
hyaluronic acid, peptides.
Oh my God, we can do.
And then if you have acne, there's different ways.
Yeah, so depending on what you need, there can be we can do it in a brightening type of hydrofacial treatment, or
hydrating. Yep, and anti-aging.
Very customizable.
Yes. And then now there is the perk lip treatment.
And it has the LED light.
Yes. That's
my goodness.
Because I did my lips first.
Mm-hmm.
They have a lip perk.
Crazy.
And I know that there is a Valentine's special that we'll post it, but you get a treatment, or you get a special take-home product after your lip perking treatment. And I love this. It doesn't hurt, but really I found instantly the lips were more pink, they're more plump.
Lips get dry during winter too.
Yes, and it makes you look old. If once you rejuvenate your lips, you'll be so amazed how much younger you can look.
Mm-hmm.
Lips are very, very important.
Totes.
Okay. All right, next. And gosh, LED. So you also get blue and red light. That's me after all of this amazing treatment.
Your scalp done on that day too?
Yes,
I
did.
Gosh.
That's all Hydrofacial. So the LED blue and red light, which helps if you have acne, anti-aging, decreases inflammation. So that is part of the Hydrofacial, guys. You pay money just on that part alone, but that is included. And then Keravive or the Hydro Scalp, this is a separate treatment, but can be done on the same day if you want to. The same vortex fusion, you can think of your scalp, especially if you have scaly scalp, if you have dandruff, if you have hair thinning. One of the theories about hair thinning is that you just don't have the same circulation. The plugs are suffocating your hair follicles, and so it's not getting proper, nutrition and blood flow. And so the Hydro Scalp, same idea, will deep cleanse your scalp. It's going to be the cleanest it's ever been.
Yes.
And infused with peptides, and then you get a take-home peptide spray, which I used.
All right, we are running a little behind. All right, what's next?
No, we're not. Okay. All right. What's next is yes.
She's so great. Dr. Judith
Mhm.
Joseph.
Dr. Judith Joseph is a celebrity psychiatrist, also a best-selling author. She actually,
I love her reels.
Mhm.
Yeah,
if you don't follow her, you should.
definitely.
But
I'm back
she
in
traveled
California for Dr. Tess's
from
signature
New York.
regenerative treatment, the time machine
Traveled
procedure.
from New York
Last year,
to
Dr.
get us.
Tess
Can you play the
personally
other
treated me
video
with a
first?
customized combination of energy-based resurfacing, ultrasound,
Lisa, can you play the
radiofrequency,
other video
microneedling,
first?
platelet-rich
Yes.
plasma, exosomes.
All right. Yeah. Here you go. Then
I'm
you
back
can
with
hear
Dr.
her.
Tess
Yes.
a year after.
And now I get to ask her, what did you think about your time machine procedure?
Well, clearly I'm back. I got that time machine that you trademarked, that set of procedures that you're known for around the world. I got it right before my book tour. And I tell you, I did over 50 speaking engagements and then over, 30 media engagements in a year. Every time I got my makeup done or I was on set, people were like, what did you do to your skin? How can I do it? And I'd send them straight to you.
Yes.
Literally took 5 years off my life. And listen, it's not about being anti-aging. It's about feeling your best. And I was tired, but you couldn't tell because my
No.
skin was glowing.
Exactly. And that's what I said. It's like when you do these types of procedure, and time machine procedure is really our signature combination protocol, combining energy-based treatments. And for you, we did radiofrequency microneedling. And then we also did soft wave, which is ultrasound to rebuild collagen. But we also use your platelet-rich plasma growth factors to really reverse the aging of the skin, get it as healthy as possible, and let it be resilient because you were doing a lot. So even though you feel tired, you never look tired.
And I was back at work the next day. There was no downtime. So it's not surgery. It's a lot of preventative things that really worked.
Exactly. It's collagen banking, it's regenerative, it's natural, and it's really for skin health and longevity. And so here you are again, a year later. It's really perfect. I really recommend people do it every year. You're not back to baseline yet, but when you do this, you just keep turning the clock.
I can't wait.
You look amazing.
All right. So there, now you're going to get to see her
Back
treatment
in
that we
California
did.
for Dr.
So she
Tess's
did it last.
signature
She did the time
regenerative
machine
treatment,
procedure
the
last
time
year.
machine procedure.
And then
Last
came back
year,
in
Dr.
again.
Tess personally treated me with a customized combination of energy-based resurfacing, ultrasound, radiofrequency, microneedling, platelet-rich plasma, exosomes, salmon DNA, and peptides. I loved this so much, and the results were amazing that I flew back from New York to M Beauty Clinic. She has locations in San Diego and Beverly Hills. This time, I did a combination of ZERF, multi-frequency RF, fractional RF resurfacing, PRP, exposomes, salmon DNA, and peptide masks. I'm so excited for the results. Anyone who wants to naturally turn back skin aging and get your healthiest, most glowing, and snatched look, try Dr. Tess and her time machine procedure. Love you, Dr. Tess.
Yay. Thank you, Dr. Judith. And you saw there our, I would say, top treatment right now. Everyone's so excited about the ZERF. And you saw part of her time machine procedure was the ZERF. That's the
That's the one. Yeah, that's
the one
the
right
ZERF.
there. And it's multi-frequency radiofrequency. You can just have the ZERF. You don't have to have it with the time machine procedure if you don't want downtime. This is our latest.
That'd be our
skin
hottest
tightening.
treatment right now, I would
Because
say.
it works.
Yeah.
Maria Arcega Dunn, you guys watch her tonight on Fox 5. She was just here today, and we did the ZERF on her, and we took a photo before and after.
Oh man, so
And
she looks even
amazing.
prettier.
We did her face in there.
Unbelievable.
So ask about ZERF if you really want skin tightening without downtime. That's very, very tolerable, and no needles. And it's really amazing to get you snatch in the jawline, neck, and lifts everything. Okay, great. Thank you, Dr. Judith. Okay.
Okay, so before we get to the rapid fire, I kind of just wanted to go over just a few things that I think some patients don't really know about. I think with moisturizers, is it true that
questions?
you should apply moisturizers on damp skin?
I mean, my answers are always, it depends.
Yes.
Yeah, it's best to really, right after getting out of the shower,
Mhm.
you really want to lock in the moisture. So right away, just be towel off and then apply your moisturizer right away. And I really recommend creams, especially in the winter time, and not lotion, especially if you have dry skin, if you have atopic dermatitis and eczema. You really want a cream and you want to apply it immediately after you get out of the shower.
Okay, and then how about drinking water consistently? Will that help with the skin moisture?
Well, absolutely. Anything that can dehydrate you, which I think that's kind of our natural state if we're
Yes.
not, making an effort, especially if you're perimenopausal, especially if you drink a lot of caffeine and if you drink alcohol, you are dehydrating your cells, you're dehydrating your skin. So replacing it with water or just hydrating coconut water, anything like that really can help your skin.
Okay.
Good.
Yes. Oh, and then this is one of my favorite things, humidifier.
Yes.
If your skin is dry, if your eyes are dry, anything, if you have allergies, whatever, get a humidifier and put it in like at your nightstand. It will
Yes,
make
it
a
does.
difference. Especially during these winter times where you may have the heater on. I definitely recommend that. That's one of my
That's a
best
pro
cheats.
tip right there.
Pro tip
Pro
for
tip.
Thursdays. Yes.
There was a question about the lip perk. Does your lips peel after?
No, there's no lip peeling after. It's not a peel. It is more of a, rejuvenation and actually makes your lips look more hydrated. So if you're noticing the lips are not as plump, if you're thinking about, oh, should I get a lip filler injection, but then for whatever reason, you want to try something before, or you're not ready for it, that is really the lip perk treatment is really for you. And the other thing that really what happens too is it makes it pink again. 'Cause
Yes,
that's one of the
color
things that
matters.
happens. Yes, and I love it. And now I'm really a lot more confident not wearing lipstick. But right now, this is one of my power
Well, because
colors.
we're,
Yeah,
this is like
but now
makeup
my
for TV kind of
regular
thing.
days, I'm like, I don't need it. I'm
Oh my God, let me just tell you guys, like ever since she started using the Our Self lip kit, which by the way, we love, and then she got her lip treatment with Hydrofacial. I swear, every day that I see her in clinic, she's like, Ange, look at my lips. Doesn't it look like you just injected it? Look at my lips.
I'm saving you because I know how stressed you are.
Yes.
I know how stressed you are when you have to inject my lips with hyaluronic acid
Yes,
filler,
that's
which
stressful.
works great. We love it. It has to be done by an artist. It has to be
Yes.
done well because you really want to look natural. And she's always done a great job. But I try to kind of like push it as
She'll be like, oh, I think I need my lips done. I was like, I gotta go
Angela
home.
is so happy about ourself.
Thank you.
Replenishing
Thank you,
lip
ourselves.
filler.
Thank
So
you,
this
Lord.
is great technology and that it delivers actual hyaluronic acid in the dermis.
And
right
this is
in
the
lip.
first time that it has been able to
Yes,
be
it's
done
just like a cream,
successfully, by
like
the way.
that.
The technology of this product
And
is
then you
just
apply it on your lip.
amazing.
Two rounds of that twice a day. And one lives in my purse, one lives in my nightstand. And I even put it on my husband because he really has lost his lips. And I was begging him if I can treat him with a injectable filler.
I even said, I was like, no, please don't do that to him. Poor James.
No, but now come over here, babe. I say hello. Okay, how good your lips looks. We practice what we preach, but now
You gotta do this, okay?
at night, look at it.
Yes.
Okay, look at it. Look, pretty good, pretty good.
No fillers. I didn't.
Okay, go ahead.
And it
Yeah.
works.
Yeah, we did this. This is our bedtime routine,
She
guys.
puts it on me.
Yeah, he will not do it. But
Oh my
it
God.
makes me very happy to see his lips full again.
Oh my God.
But it is again, okay.
Yeah. Thank you. Thank you, sir, our model.
Yeah.
Oh my God, speaking of model, I don't know if you guys follow Tess and I on Instagram, but our brother Rick apparently is now a model
Oh my
who
God.
has been unintentionally hired by San
not
Diego, but not paid.
But hey, it's saying a lot. They wouldn't pick you if you weren't like.
They're low on models, I think. think they're just
That's
low
what
on
they're doing.
models. I cannot with it.
Rick said someday you too could feel the way he feels.
Right.
Okay, so there's a kit that we all love. This is it. This is a kit. It's the replenishing, it's the replenishing lip filler, which is what James and I use, and Angela, everyone in the clinic uses this. It comes with a refill. And so you basically keep this, and then when it runs out, you just pop in a cartridge. And then it also comes with the lip conditioner trio. So
And they're colored too, which is super
they're
cute.
so
They're like lip
amazing.
glosses.
Yes, I like it. I really, really love them. All right, so yeah, so right here comes in 3 colors. So that's the whole kit, and it works. So it's not like a regular lip plumper that just causes irritation, inflammation, and edema, that it's temporary. Actually, this is, instead of injecting hyaluronic acid, you are delivering topically hyaluronic acid. So this is a true patented delivery system for hyaluronic acid, which in the past, it was too big. It just sat on the surface. It really didn't penetrate.
Yep.
Yes. Okay. And ourself also has an eye product. So if you find that your eye, your under eyes especially are dry, which mine always is, they're
Mine
always
are
dry.
too.
There's an eye product. This one is the eye serum. So you just do a tiny bit, and then you pat it on, the area there, the under eye. And then they also have a full face and neck serum. And it's not super hydrating for those who have really, really dry skin. I think of this more as hyaluronic acid delivery in the skin, and then you can add on your moisturizers if you feel like you need it. But I use this for my face and neck, and then of course the eye serum for my eyes, and then I use the Illumia MD Hydra Rich, and then their sunscreen, and the retinol.
Yes.
So, okay. Lisa.
So the question is that around her lips get really dry. What would you recommend in addition to all of that?
It really depends. So this is again one of the reasons why it's good to go to a dermatologist, because we have to find out why your
Yes.
lips are dry. Maybe you are having
Toothpaste.
a contact dermatitis. Maybe you're getting irritated by the products that you're using. So maybe you have a true allergy. Maybe you have a pre-skin cancer. There's a lot of different reasons that dermatologists will know. And so that has to be figured out. And we'll get to the bottom of that, and then we can give you the solution.
Yes. So find what the trigger and cause is first.
And then what else is next?
What's
We
next?
have the
Let me
raffle.
share-
Oh yeah, the specials.
Yeah, let me share this.
We have our winter specials for all of you. Really should take advantage of these.
So really quick, if you want to go over it.
Yes, so the pricing for the lip set that we talked about, that's $210. And then the face firming duo, which is the eye and the face serum, is $242. There is those of you who want to actually try and talk more about the science of it. We are going to have a pop-up on Tuesday, February 10th. I will be in the clinic. My brother Rick will be in the clinic as well.
The model.
And yes, exactly. And the ourself rep will be there to basically demo it, talk to you, and you can pick up your
So it's a perfect time. Please stop by.
Our patients love them, and personally love. So
Yes.
okay, and then next, yes, these are our winter specials. So Hydrafacial, the glow peel, let's see.
Buy one, get one free.
For glow peel.
What?
That's amazing.
Okay, that's like a super good deal. So my 42nd birthday is in 2 weeks, and that actually is one of the treatments that I had just done. I did it a week ago. I love to do the glow peel specifically before my birthday. So if you have a big event, do it 2 weeks before, because your skin needs about a week or so for it to go through its exfoliation phase. But my gosh, your skin will look filtered. So please do that. That is an awesome deal. Like
That's
literally like
crazy
fall
deal. Why are we
morning.
doing that? I didn't approve.
That might be a
Just kidding.
typo.
Yes.
Just kidding.
And then PRFM,
PRFM.
$100 off platelet rich fibrin matrix. I'm so happy that the world's finally catching on. Do
That is
not
one of those things.
stop
Yes.
doing hyaluronic acid filler injections in your under eyes.
No filler on the under
You
eyes.
can go
please.
blind. They could clog you, block your lymphatic. You can have like swelling. You can have discoloration.
Yep.
That's permanent. You can have lumps. Platelet-rich fibrin matrix is the way to rejuvenate the under eyes. I told you my age, and this has always been, my under eyes has always been my biggest problem area, and I've been able to really correct it with time machine procedure treatments and platelet-rich fibrin matrix to naturally volumize. You'll never look dead. You'll never have any issues. It will only get better. $100 off, 20% off Lume products, the ones that we talked about, the Prep and Enhance Kit, the Microderm Polish, and the Aqua Infusion Mask. But you have to come to the clinic to pick them up so we can say hello to you and we can show you what's in the Prep and Enhance kit, and also if you have any skincare questions. And finally, for hair, you can't forget the hair. You have to be, this is all ours. You have to be proactive about hair. And one of the best ways to be proactive about preventing hair loss, especially if you're on GLP-1s, especially if you're, you're perimenopausal and menopausal, postpartum, stressed out, which all of us are. You need to really think about maybe trying out at least a supplement. We have other hair treatments like platelet-rich plasma. We have a laser,
but
we have the
supplements
hydroscalp
at the minimum.
Yeah,
for sure.
Easy, 2 per day, 2 gummies per day, and you can buy 3 for $206. All right, and let's see, raffle. Yes, you already said. Those of you, I guess nobody dropped out. They all really
I know.
wanted
I'm
a
like,
chance to
wow,
win.
everyone's there.
This is super cool. Signature Hydrofacial. You guys saw every single one of you. There's 19 of you. If you didn't win, you still should get a hydrofacial treatment. And one of you will win the Glow Peel that Angela and our patients love, especially if you have a lot of discoloration. And it's also amazing for acne, skin, and the scars. So that's
Wait,
it.
I did promise this rapid fire thing. We'll take 2 minutes.
Rapid fire.
Okay. Which is worse, picking pimples or sleeping in makeup?
I'm picking pimples.
Okay. How much collagen or volume do we lose naturally every year?
Every year, it depends on, if you're postmenopausal, 5 years, if you're not replacing your estrogen, 20% of your collagen is lost within the first 5 years of menopause.
Really?
Yes.
What?
It is a lot, which is personally, since I've gone through menopause, I feel like hormones, really that estrogen loss affects your skin more than you think.
Kind of shook about that. My gosh. In your opinion, who has the best celebrity skin? Dr. Tess has met and seen and treated a lot of celebrities.
The best.
Who has the best celebrity skin?
Well, I mean, Cardi had great skin.
Really?
Yeah,
Oh,
Cardi. Kim has incredible skin too.
Actually,
Yeah.
Kim is gorgeous.
Yes.
Okay, so I don't care what anyone says about her.
Yes.
Like, we have seen her in person. We have touched her. And she is kind, and she is really beautiful. Like,
Yes.
without an ounce of makeup, she looks like that.
Yes,
like,
it's really true.
beautiful.
It's not a filter. It's
She looks like that.
And so she has incredible skin. So does Cardi, and she's
Yeah.
so cute.
All right, what is your personal skin regret?
Personal skin regret is that I didn't start treating my neck
Oh, that is true, actually.
earlier because I only really concentrated, which most people probably do, concentrate on treating their face. And the neck, actually, aging of the neck is a lot tougher to address because the skin there is so thin. There's no oil glands, there's no hair follicles. So even with lasers, we have to be a lot more conservative. Also, if you're not overweight, fat, there's no fat there, so there's no cushioning. Not like here on the face, there's a little bit more cushioning. So I wish I started doing, skincare at least, and also even sun protection. I didn't really put sunscreen on my neck. I do now. But that definitely is my biggest skin regret. But we're trying to reverse that with Zerf. And you did a little bit of Time Machine, Zerf, You did a little
We
bit of
did
Botox.
some, yeah, which actually I was like, we did the Nefertiti lip. It looks really good.
Yeah, this is.
If I may say so.
Great job,
myself.
Angela.
I know.
You'll get to do it again
Oh,
because you did such a great
no.
job. So that's it, I think, right? Thank you all for joining us. I hope that you learned, you had fun with us with all the products. We will email blast this Zoom as well, and then
Get a humidifier.
Yes. Oh,
Actually, one of the participants said, great idea on the humidifier, but also Danica says your neck is flawless.
Oh, thank you.
Now
Danica.
it is.
And also,
Well, that's a good lighting,
a
but
question
it is so much
No,
better.
it really actually
It
is
is.
very
I
good.
love it.
is microneedling best for glow, smaller pores, and skin scarring reduction?
Yeah, so it depends. It depends. This is why you guys need me. So we have to take a look at your skin. If you're rosacea prone, if you're really, really fair skin, you're prone to broken capillaries, redness, flushing. Actual microneedling may not be the best for you.
It's not like I can't ever say that I jump and say, yes, you need microneedling.
Well,
it's for me, it's
also-
never my number one.
Also, microneedling alone is different than the microneedling that we do here with our
Correct.
time machine procedure, and also radio frequency microneedling is completely different than microneedling that is offered in med spas. Okay, so you have to make a distinction. At M Beauty Clinic, we hardly ever, if ever, probably never,
I don't think I ever
just do
just
microneedling alone because the results are so subtle. It's really not worth the money. We have better ways to address your
Totally.
scars, better ways to reverse aging. And so that's my answer.
I do have another kind of thing about it. Like
Mhm.
I think that you see a lot of places marketing microneedling because they may not have technology that is better. Microneedling is like you have like a handpiece and then you can perform it, but it is not really clinically an advanced treatment in our opinion.
Also, a lot of estheticians are doing microneedling, which they're not supposed to under their license.
Correct.
Estheticians, if you go to a med spa or like an esthetician's office, they're not supposed to puncture the skin. And microneedling, because their needles puncture the skin. So this is actually not within the scope of practice for an esthetician, but they do it a lot. And this is something that they can offer to their clients. And so that's why it's gained popularity, but just be careful because, when your skin is punctured, you are at an increased risk for infection, and an esthetician will not be equipped to handle if you have complications. Next.
Last
question.
Can you please repeat the treatments you did for your neck?
Oh my gosh, do we need to have a neck Zoom?
Let's do a neck Zoom. I think the next Zoom.
Next
Zoom
is going to be a neck
Yes.
Zoom.
Yes, so I'm happy and proud to say that this year I'll be 55, and my neck, I didn't, like I said, one of my biggest regrets, I didn't really take care of it. But over the years, I have been treating. We've treated it with obviously our number one signature, age reversal treatment, our time machine procedure, like you saw with Dr. Judith. So I've had ultrasound, I've had soft wave in my neck over time, right? This is not like all together. And ZERF, I've had it done. Most recently, it's been ZERF. The last two treatments that I've had was ZERF because I didn't have downtime. And then also injections of platelet-rich plasma because my neck is very, very thin.
So
The
that
skin's very
PRFM,
thin.
the one that is on sale for our attendees, it is $100 off the treatment. So instead of using fillers, we're going to use PRFM, and that is a natural way to rebuild collagen. So we will put it along the lines here. And then
I put it on my temples,
that's right,
my
under eyes.
this part of my cheek,
Mm-hmm.
the outer
To help
part here.
rebuild some of the volume loss that happens here.
Wow, that profile is looking pretty
It's
stuck,
not my
guys.
first rodeo with
Yep.
doing injections.
And also
my
the other
friends.
great place for PRFM are the hands. I've had that. Look at my hands.
And that actually is now the other area that I think you started to really begin
concentrate.
treating, because it was bothering you about 5 years ago.
Bothering me a lot 5 years ago that my hands in photos were aging. So I've done soft wave, and I've done like fractional radio frequency in my hands, but the platelet rich fibrin matrix injections work amazing.
So that's into this part here to help add volume and to help minimize kind of like the creping.
Yes, exactly. And the Nefertiti lift
is with
essentially
the Botox or Jeuveau.
Botulinum toxin.
And that needs to be done by an expert. That is a very advanced injection.
You can
technique.
get drooping, you can get crazy possible.
Yeah, so
if it's not
you gotta
done
go
right,
to a very experienced injector.
Would you recommend PRFM for the lips?
That is a great question.
It's possible. I've done it before. PRFM can be very inflammatory in the lips, so it can make you very, very swollen. If you're doing the time machine procedure anyways, then we do just PRP. It's less inflammatory in the lips. So I would do PRP, no problem in the lips, but I really would not do the PRFM there unless patients like really are so volume depleted that even if they're swollen, it wouldn't look weird.
But I mean, it is not typical practice for that to be done. Oh my God.
Okay, last but not least,
yes.
Comment from a patient named Tess. She actually said, just wanted you to know, I always appreciate your honesty, care, and personal connection you have with your patients.
Aw, thank you, Tess.
Tess to Tess.
Tess to Tess. Love you. Thank you. And thank you all those who are already part of our M Beauty Clinic family. Thank you so much. We truly, truly appreciate your trust. We know there's so many other places you can go to, and hopefully today we gave you some reasons to stay with us or like recommend us. We really do take pride in taking care of our patients and offering you the latest technologies, keeping you looking natural, keeping you just looking youthful. And we practice what we preach. So you come here and inspect my skin and I don't know, I mean, at least my skin.
Excuse you. Okay.
I
have had quite a skincare journey as well.
You
I
look
have,
amazing.
yeah.
You have been looking
Really?
really
Thank you so much, right?
Yeah,
so 55 this year,
glowing. Yes.
42 in like 2 weeks. And I think we're doing okay.
Oh, we're doing great. We're doing great.
Doing okay.
All right. So have a great evening.
Have a great night. Thank you for joining us.
See
Dr.
you
Tess, Nurse Angela.
Bye.
Bye.